Hi, I'm Tina. I'm one of the hygienists here at High Point Family Dentistry, and I want to take some time and talk a little bit about oral cancer. April is Oral Cancer Awareness Month, and it's very important, of course, in the dental field. Almost 50,000 people each year will be newly diagnosed with oral cancer, and it ends up that in the U.S., one person every hour passes away from oral cancer-related symptoms. So, of course, we know smoking and tobacco use is a really big risk factor in developing oral cancer, but there's a faster, more prevalent population growing when it comes to new oral cancer diagnosis. And those are patients in connection with HPV virus. And these are patients who are otherwise very healthy. Young individuals, usually non-smokers, don't have a lot of other health conditions. And that's very scary for us, and we want to make sure that early detection is done. So, biggest prognosis when it comes to surviving oral cancer and making full recovery is that early diagnosis. So here in our office, of course, we're going to always do our part. So biannual checkups, making sure that we do an oral cancer evaluation and a screening at every visit. So there's also been a recent push in the oral health community to encourage our patients and to encourage you to be proactive at home and be your own advocate. So screening or looking at yourself at home can possibly be even an earlier detection and save so many lives when it comes to early diagnosis of oral cancer. So what you can do to protect yourself at home is a complete oral screening, an exam. And there is a great one online that the Oral Cancer Foundation has put out. So it's a resource and it gives a step-by-step initiative of how to do it on your own. So it's called checkyourmouth.org, and to help guide you in completing that self-exam at home. So you want to look for anything different or new that you've never noticed before. These can be bumps, lumps, cut or an ulceration. It can be discoloration, white, maybe red or black even. Bleeding in an area that doesn't seem that it should. It can be a tender area if you palpate or touch those spots. But also the most important thing, anything that you do notice, if it does not heal within that 2-week time frame, so 14 days is really the hitting the nail on the head, so to speak. So if it doesn't heal within 2 weeks, you want to make sure you give us a call or your dental office a call and have it further evaluated. So if you do have any questions, any concerns, or if you find something in your own mouth that you want to have looked at further, we'd be happy to assist and do a full oral cancer evaluation. But the key to treating oral cancer is early detection. So we just want to be our part of the puzzle and make sure that all of our patients are being their own advocates. So we really appreciate your time. Thanks.